Few people have done more to support global public health than Bill and Melinda Gates Foundation co-chair Bill Gates. Up next, Bloomberg editor-in-chief John Micklethwait gets Gates' take on how we can eliminate COVID-19 and move beyond this pandemic to start making plans to prevent and better respond to the next one.
Bill Gates, thank you for talking again to the New Economy Forum and Bloomberg. We now have a couple of vaccines on the market with 90% effectiveness, supposedly. I wonder, from the point of view of people around the world, what's a reasonable timetable to expect going forward now? When do we expect a reasonable number of people to be covered by this?
Well, the mRNA vaccines, which did such a great job of getting into trials quickly and now are being approved, they are the hardest to scale up in volume and reduce in cost. But because the results, the Pfizer antibody levels were about middle of the pack, it means that Novavax, Johnson & Johnson, and even AstraZeneca, which was slightly below, are very likely to work. And those are vaccines that are low cost, don't have the cold chain requirements. And we have Indian factories, second source factories, that are by far higher volume than any Western vaccine factories, actually already making AstraZeneca and standing by to make Novavax and Johnson & Johnson. So if we can get those three, in addition to Pfizer and Moderna, then you can get into the billions of doses as you get towards summer 2021, and the supply constraints won't be very bad. So it's very good news that the efficacy of Pfizer was so high, and what that means for these other vaccines.
And what do you think about the kind of politics of this? You pointed out before that rich countries quite reasonably in some ways want to prioritize their own citizens, but there's a lot of people around the world, and I know you've personally helped pay for these in some places, but when will these reach out to the people of the poorer parts of the world?
Well, normally you'd use a market mechanism, and whoever's willing to pay the highest price would be first in line. For global health, that's really inappropriate. Now, of course, the rich countries that help fund the R&D, including the U.S. through the BARDA efforts, they will get some prioritization. The only way to square this contradiction is to get the volume up. And that's why the high volume vaccine industry, India makes $2 vaccines, the Western companies make $200 vaccines. The big volume, the big factories are over there. And for most of these types of vaccines, those companies, Serum, BioE, have the capacity. They don't for mRNA vaccines because of the lipid. So there will be some preference into the rich countries because of these reservations that have taken place. But this novel second source thing that we funded through with several $100 million to those Indian companies, where they're literally making AstraZeneca vaccine right now in higher volume than any other factory ever will, that can get it so the developing world delays like a 4 or 5 month delay, which will reduce the total deaths dramatically from this if we had to force the developing countries to get to the back of the line.
So you're going to have to see a process where, to begin with, it goes to the rich world, but is it kind of by the middle of next summer, say, that you're beginning to see the sort of penetration?
Indian factories will send all of their output to developing countries. So India domestically, and then Africa and other low-income countries. So we have factories in the West. It's never been done that one company invented a vaccine and then other companies use their factories to manufacture that vaccine. Usually it has to essentially be reinvented to get into another factory. And so that's what's so novel and why we went and reserved that capacity back in the spring, because that capacity is so gigantic and it can work for these constructs. The world did not rehearse for this. If we had rehearsed the idea of how we stitch together all this factory capacity would have been talked through, and there would have been a way of doing that, and the U.S. would have been part of that dialogue. As it was, all these second source agreements were done by the foundation paying out money and using the relationships and expertise we had with the Western companies and the Indian vaccine companies.
Do you think there's a role for the public sector, though? Do you think that the governments could come in and do more on this? Western governments? I saw you praised the British government, actually, on this.
Well, each government has had certain mistakes and
pluses and minuses.
Some things they've done well. In the case of the U.S., the only thing they've done well is they funded more R&D, not just for U.S.-based companies, but for companies around the world, including a lot of these European constructs. And, that was a good thing. That was a favor to the world. The rest of it, the U.S. is sort of at the back of the pack. The diagnostic work we did, the messaging, even today, the messaging is reaching a new level of incoherence.
Just on that, very quickly, I'm going to come back to vaccines, but you look at the numbers. I just looked again on the Bloomberg virus tracker. You look at the deaths for every million people. America's now close to 750 deaths. China, the other great participant in this conference, is around 3 deaths for every million people. Obviously, one number may be a bit overcounted, the other bit undercounted, but by any measure, one country has done enormously better than the other. Why has the US been so bad compared with other people?
I don't think comparing China and the US is that helpful, because China has a more authoritarian control over behavior than the US does. But if you compare the US to South Korea, Australia, the contrast is every bit as dramatic as it is with China. And so we didn't catch the epidemic at that early stage where the numbers are small before they get exponentially big. And we are facing, which the IHME model predicted, that the fall will be very tough. Some people didn't think the fall would be tough, but as they had looked at the numbers and saw in places like Brazil how the austral winter affected infection rates, they saw that. And so the bad news is the next 6 months in the Northern Hemisphere will be very tough. The good news is that both the vaccines and the therapeutics, in particular the antibodies, are coming along and will start to bring that number way down.
But up to that point, presumably we must rely on masks and all these things that America has not been, and testing especially.
That's right. The behavior, the using the test for people, and then if they test positive, you contact trace, and those people make sure they're not infecting other people. The U.S. still has a long ways to go on that. Although the numbers are so extreme, you do have finally more agreement that restaurants, bars, a number of things will have to forgo during this next 5-month period.
Were you surprised by how badly America has done on that? Very quickly.
Oh, it's mind-blowing. We have so many more PCR machines per capita than any other country. We have the CDC that has the deep expertise and had practiced how to communicate appropriately to the public. They made some mistakes early on, then they were completely muzzled. Nobody even knows the name of the people underneath Redfield who would have been the key communicators. And we had this so-called task force. So it is disappointing. We don't get to go back and change that. But we still have a chance to wear masks. In fact, that at healthdata.org, that's the IHME forecast, they show a line that if you have good mask wearing, that you save now over 100,000 deaths in the US over the next 6 months.
Do you think this is just going back to the vaccines, do you think this is a disease that can actually be eliminated, or is it one that ends up being controlled, it becomes endemic, a bit like the flu? And what does that mean in terms of supporting vaccination programs going ahead?
That's a super good question. And we don't know enough yet to say, can we do the elimination of this? That would be the best, because then zero is magical, because it just doesn't
Mm.
spread at all. It doesn't come back. I think there's a good chance we can do that, but we'll have to look at the vaccines, how good they are at blocking transmission. Because this is a super spreader disease, it is likely we can do that. Otherwise, we'll have to maintain immunity on an indefinite basis, which probably means booster shots. And a little bit as people come into the country, do they have a digital certificate that says whether they've been vaccinated or not, which that's fairly complex and will need for a period of time, like we've tried to do with yellow fever. But as the U.S. rejoins the WHO, this idea of what does the vaccine certificate look like, hopefully that dialogue will begin.
You look at this virus, coronavirus was tough, but it's possible you could have much worse viruses. And how should governments, look at the world beyond? How should governments prepare? Should they have a system? Should there be a certain amount of money that people put aside every year just to retain vaccine fighting, so that if something worse comes along, we can deal with it?
Yeah, so there's investments that are probably tens of billions a year for the rich countries that are both on the R&D side to get these platforms so that the vaccine would come much faster, the antibodies would come much faster, and we can do testing not like a 1 to 2% per week of a population, but more like 25% per week. So that we need R&D investments, but we also need several thousand people who are engaged in working on some chronic infection disease like malaria, polio, measles, who have the skill sets and are ready to switch over whenever a pandemic starts to emerge. And they need to be paired with a very strong surveillance capability, including in Asia and in Africa. So the cost won't be large compared to, say, the cost of the military. But people will expect governments, particularly the rich ones, to step up with those tens of billions of dollars. And, I wrote a New England Journal of Medicine article back in 2015. I'm a little smarter now about what those investments look like, but it's largely that plan.
But the way that a company should think about it, in order to incentivize companies to keep on doing this, is that the key bit? I remember years ago you telling me that the problem with the vaccines is that you give them mainly to people who are well, and so there's always this big liability thing coming behind it. But if you look forward towards these more dangerous things, do you almost have a permanent monitoring force of companies who in the end are paid for in the same way as you might pay for defense?
Well, we expect that the mRNA platform will solve the cold chain and the cost and scalability issues, and so that its speed of development, which has proven to be the best, is there for this next pandemic. And you'll have standby agreements for huge mRNA factory capacity to call on when this problem comes up. Likewise, for antibodies and these miracle testing machines that we think actually come from testing seeds, we can get a very high volume approach going. So we will be really a lot more ready because, as you say, it could have been 10 times, 20 times more fatal. The bad thing was that it spread very effectively, but the death rate was fairly low, and the difficulty to vaccinate turned out to be quite much better than we might have expected.
How has it changed your approach? How has it changed your mindset? You're good at reacting to these sort of things. When you look at COVID, how has it changed your view of the world? Has it changed your view of the balance of power between the West and the East? Has it changed your view of how the relationship between business and government should work?
Well, how we orchestrate the private sector for who have the skill sets for a problem that it's up to the government to be prepared for, that we need to be smarter about that, because it's the private sector innovation that's getting us the solutions, but it had to be government resources and coordination and regulatory approvals that people think, okay, I do trust this vaccine and I'm willing to take it. Unfortunately, the Chinese vaccines didn't find a high quality regulator and get that process going so that the WHO could draw on those. That still may happen, but it looks like it won't come on a timely basis relative to the Western vaccines. My basic model of the world is that innovation can solve a lot of problems, and here with the idea of self-testing or the antibodies or the vaccine, the bets we made as a foundation are largely working out, and that's why we can see an end to this thing and a return to normalcy. So my bias towards innovation and combining the government and private sector together, that's been deeply reinforced by this tragic pandemic.
Just to push you on that lastly, on the private, you've been a great believer in the private sector and innovation. You look at this disease, you could say, isn't it amazing what the American private sector has done? It has produced this vaccine. The drugs companies have worked quicker than we've ever known. And yet, as I said earlier, America's heading to 250,000 deaths. And it's like the private sector has worked and the public sector has not worked as well. Government has not worked as well. Has it changed your idea about the balance between the private sector and the public sector?
Well, the role of the CDC can't be taken over by the private sector. The kind of messaging and getting people you trust to be the ones telling you about masks and changing your behavior. And so we're just going to have to improve government. There are things government is absolutely necessary for, R&D. Yeah. Basic public health, including in Africa, running really good primary healthcare systems. So, we just need to give them better tools, better metrics, and rehearse for the emergency. If we had rehearsed for this thing, we would have been so much better off. We wasted those critical months, particularly in the US, not having the testing and the messaging to avoid getting to those very, very large numbers. And sadly, that's true in a lot of Europe as well.
Okay, thank you very much for talking to us. And hope to see you again soon.